The advantage of the IQon is we've always got the spectral data.
Always on means information instead of sending patients to other examinations. We've also seen very useful applications, for instance, in assessment of pulmonary embolism. We can pick up small perfusion defects in the lung without the need for, or as incidental findings that would otherwise not be recognized.
Self-confidence comes from the image quality that we get, and what we found with the IQon and being able to use the spectral data that we have, it just gives us a bit more reassurance when you're reporting the scans.
Because we get the conventional image, so some image which we got the last 40 years from CT, we're very, very confident in using the system because you don't have to look for something you never saw before. You always